Good evening, everybody. How many people are excited about this? How many people are regular exercisers?
Sort of.
About half.
What do you mean
That's
regular?
good. That's all in your own interpretation, isn't it? How about more than 2 times a week?
Yeah.
There you go. Well, my name is Misty Paris. I am the manager of the Cardiovascular Wellness and Rehabilitation Center, which encompasses both the LifeQuest department. How many people have heard of the LifeQuest department? It's the community health education, yep, and the cardiac rehab department. So you've done that too. Anybody else have gone through any of those? Just heard of them. All right. Let's hope you don't have to go through the cardiac rehab.
Yeah.
That's why you're here, right? How many of you have heard of the food pyramid or seen the food pyramid? We all have seen that, right?
Yeah.
Well, they have come out with an activity pyramid now to show us what we should and shouldn't be doing. So, you know, in the food pyramid it says, you know, how many carbohydrates you're supposed to eat, and how many beans and fruits and vegetables, and at the top it says what? What do you use the least of? Sugars, fats, oils. So what should you do the least of for activity? Sit.
Sit.
That's right. We always say
Watch
sit
TV.
sparingly, watch TV. Unfortunately, we're moving to a society that we sit a lot more often. I for one am behind my desk all the time. And so unless I'm telling myself to get up, move, actually take a break from my desk and move around, I'm not that active throughout the day. That's why we have the activity pyramid. It used to be in times past, we were active. We moved throughout our day. We don't do so much anymore. That's why we have to actually carve out time to exercise and do resistive training. You can see on the activity pyramid, everyday activities. So just going out to your mailbox, walking your dog, those type of things count for everyday activities. Those are not cardiovascular exercise activities. Aerobic activities, things like going for an actual walk, or jogging, or swimming, or bike riding, playing tennis, those types of things are aerobic activities. And we're going to talk about how much and how often you should be doing those. Flexibility and strength. Sorry, we're working on our PowerPoint, but you guys all have these in yours.
Yeah.
Do you? Okay.
Yeah.
Flexibility and strength you want to do a couple of times a week as well. We used to not incorporate that into teaching people what to do. We used to just say aerobic activity, but we're realizing that flexibility and strength are just as important. So that's going to be the basis of my talk today, is some of the strength training and why it's so important, especially as we age. All right, so I'm moving on to the next slide, and it's talking about our muscle fibers. So we have 2 main muscle fibers that help us move. We've got slow twitch fibers. Those are fatigue resistant. Those are the fibers that help us move throughout our day, help us walk. They use a lot of oxygen to keep them going. They don't contract as rapidly or forcefully. That's what keeps us moving. The second type of fibers are fast twitch fibers. Those are the fiber types that we lose very rapidly as we age. Those use the non-oxidative system or the non-oxygenated system. So those are the things for resistive training. Things like getting up out of your chair. Do you think that uses slow twitch or fast twitch fibers?
So,
It's actually fast. Getting out of a chair. Because you have to
how you get up.
Well, you have to contract your muscles really quickly to get up out of a chair. Once you get moving, you use your slow twitch fibers. But to get up out of the chair or grab something from the cupboard, carry a gallon of milk. How much does a gallon of milk weigh?
5 pounds.
8 pounds.
What?
8 pounds. So if you're carrying a gallon of milk, that's using a fast twitch fiber to lift it from down here all the way up on to the cupboard. Those are the things that we lose very quickly as we age. So if we don't use resistive training, we will lose it even faster. The other way to gain that is to do sprinting exercises or anaerobic exercises. Well, we don't recommend that as we age. We recommend doing the resistive training type of exercises. So on the next slide, you'll see comparison effects of aerobic training versus resistive training. This was really interesting to me to see how both resistive training and aerobic exercise help in all of these areas. So bone mineral density. Obviously we see that resistive training helps a whole lot more than just doing aerobic exercise. Why do you think that is? Anybody want to guess? Resistive training is a lot more weight bearing, right? You're actually creating more muscle mass to keep that bone mineral density. So body composition, fat mass. Obviously aerobic exercise, because you're burning a whole lot more calories, is initially going to decrease that fat mass quicker. That's why they say when you're trying to lose weight, you do a lot of aerobic exercise. However, I'll show you how strength training exercise really helps increase muscle mass to decrease that fat mass. But aerobic exercise in and of itself, doing about 45 minutes a day, at least 5 days a week, is what's recommended for weight loss to reduce that fat mass. Muscle mass, aerobic exercise doesn't do anything for. It really remains neutral because you're not doing a lot of strength training during aerobic exercise. A little bit of jogging might help with some of your leg muscles, but really it's the resistive training that's going to increase your muscle mass. And of course strength, aerobic exercise doesn't do a whole lot for, but resistive training is going to increase that fast twitch fiber that's going to increase your strength. So glucose metabolism. Those of you that are diabetic or insulin resistant, you'll see that both aerobic exercise and strength training exercise is equally important to help with the insulin sensitivity. So they see just about equal benefits from strength training as they do aerobic exercise. That's pretty significant, and it shows how important both are. Serum lipids, so your cholesterol, everybody knows the difference between your good and bad cholesterol, right? So your LDL is your what cholesterol? Bad. That's your lousy cholesterol. Your HDL is your good cholesterol. That's your happy cholesterol. The main way to get your good cholesterol up is through what? Any guesses? Exercise. Exercise is about the only way to get your HDLs up. A little bit of the olive oils will help with some of that, but exercise is the natural way to get your HDL up. You'll see some of these major athletes with HDLs in the 70s because they do a lot of exercise. That's the one thing where more is better for aerobic exercise to get those HDLs up. And it does help decrease the LDLs as well. Resting heart rate, obviously aerobic exercise is going to decrease your resting heart rate, but they also showed that strength training reduces your resting heart rate because obviously your heart is a muscle too. So when you're doing resistive training, you're actually working that heart muscle to help it to adapt so that it's not having to work so hard when the blood's pumping through it. Blood pressure. We know that aerobic exercise is great for your systolic and diastolic. Everybody knows the difference between those two, right? Systolic is the amount of pressure that's in your artery walls when your heart's contracting. Diastolic is the amount of pressure that's in your artery walls when your heart's at rest. So when you're exercising, what do you think happens to your blood pressure during exercise? Goes up. Right? It needs to adapt to how much blood's going through it. But when it's at rest, what's it going to do? It's going to go down. Initially, right after exercise for both strength training and aerobic exercise, you'll probably see a good decrease in both your systolic and diastolic pressure for a few hours right after exercise. And the hope is that it continues to get lower and lower over time. So physical endurance, obviously aerobic exercise is going to help with physical endurance. Your daily activities, things that you're doing all the time, it's going to help you do those more. Strength training, however, helps you get to do those activities. So if you can't get out of a chair, can you go to your mailbox and go get your mail? No, you need to be able to do those types of things, you know, getting out of a chair, getting cans from your cupboard, that type of thing, to be able to continue to do your activities of daily living. And your basal metabolism, so that's how many calories you burn on a given day if you were to do nothing, just at rest, your basal metabolism. Aerobic exercise increases it a little bit, but strength training increases it even more. Why do you think that is? What do you think burns more calories? Muscle or fat? Muscle. Absolutely. I found this interesting. Between the ages of 20 to 70, people lose about 30 plus or minus 10% of their muscle mass. So that's an average of 5 to 7 pounds of muscle every 10 years. That's significant. That's not just, we're not talking just a little bit of muscle mass every 10 years. That's significant if you're not doing any sort of resistive or strength training. I mean, it's called sarcopenia, and how many people realize, and I didn't realize this, but half of women over age 65 can't lift 10 pounds. Isn't that crazy? That's a gallon of milk. They can't lift that from the car to their cupboard. That's pretty significant when you're looking at as we age. I don't want to be there. I want to be able to lift a gallon of milk until I die. So I realize the importance of strength training. So shifts in body composition. Who knows what that might be up there? How many pounds of fat would you guess that is?
30.
10. 10 pounds of fat. That's not a whole, doesn't look like a whole lot, does it? But you think as it intertwines in your body, it gets around your organs, that 10 pounds of fat can wrap around a lot of things. I found this interesting, this shift in body weight and body composition from ages 20 to 50. So you'll notice the first one, 20-year-old, 126 pounds. 45 pounds of muscle. So you think, 45 pounds of muscle this 20-year-old is starting at. If she loses 5 to 7 pounds every 10 years, she's not going to have a whole lot of muscle mass when she's 65, is she? Maybe 10 pounds of muscle mass? That's not going to help her do a whole lot. So she's 20 years old, 126 pounds. She has 45 pounds of muscles, 29 pounds of fat. Her body fat percentage is 23. 10 years later, she doesn't look overweight to me. Does she look overweight to you?
No.
She weighs 136 pounds. She now only has 40 pounds of muscle. So she's lost 5 pounds of muscle and gained not only just the 10 pounds in fat, but an extra 5 pounds of fat on top of that. So she's gained 15 pounds of fat. So now she's at 32% fat of body weight. She gets to 40, she's now 146 pounds. That doesn't look like that looks like an average person walking around, doesn't it? That doesn't look abnormal. 146 pounds. We wouldn't say 146 pounds looks, to somebody saying 146 pounds, we wouldn't say that's a lot of weight for the average person. But now she's lost 5 more pounds of muscle and gained another 15 pounds of fat. So her body fat percentage is 40. And again at 50, she did the same thing. So she's down from 45 pounds of muscle to 30 in 30 years. And now she's at 74 pounds of body fat. So that's pretty significant as we look at an average person every 10 years gains about 10 pounds. But we don't take into account the fact that we lose muscle mass if we're not doing any sort of activity.